out to you ASAP. So I think that's probably it for details. So, navigating the system. That's me, Jan Robson. I'm the Provincial Education Coordinator at the Alzheimer's Society of BC. And here's our agenda for today. So we'll look at considering available services. So when you're in a position where you do have a family member with dementia and you're starting to think, you know, we should at least be checking out what's out there, what is out there, looking kind of a broad map of what's available in the system. Some of the eligibility requirements around accessing these services. Decision making. How do you go about making some of these decisions? These are significant life transitions, and sometimes the decisions can be very difficult to make. And encouraging service use. So they may be difficult decisions for you as the caregiver, as the supportive family member to make. They're also extremely difficult transitions for the person with dementia. Accepting help. Some people are really good at it. Some people, it's a real challenge accepting that they're at a point in their life when, in fact, they need some of this help. So we'll look at that a bit. Just want to stress that this workshop is under an hour. We do this workshop as part of our education program through the local resource centers. So if you do have the opportunity to take it in person, if someone is coming into your community or if the resource center is actually located in your community, I would really encourage you to take advantage of that. Much as I think, that these teleworkshops are helpful, they're useful for people, they really can't take the place of being there in the same room with people and having that discussion. So please do take advantage of that if it's available to you. So the public health care system, what we'll focus on today is home and community care. And so this goes by slightly different names depending on the office, on the community. But basically we'll be looking at some of the services available within communities. I have something that's dinging in the office here. Okay. The services are provided by 5 regional health authorities. There's Fraser Health, and so that would be Burnaby, Tri-Cities, Surrey area. It's a huge catchment area. Interior Health, Kamloops, Kelowna, again, huge catchment area. Northern Health, Vancouver Coastal Health, and Island Health. So these would be the 5 regional health authorities that would provide these services. You can look at some of the services available on their website, or by all means do give them a call, but check the website. I do want to stress as well that, you know, we tend to go to this, to the websites as being our go-to resources, and recognizing that some people do not have access to the internet. They either just don't have the equipment available, they don't have the ability to use it, whatever it is. So by all means, if you're interested in learning about some of these services, getting some information in print, do call our dementia helpline because they can get information out to you. So the number for the helpline is, and I just want to make sure I don't miss a number, 1-800-936-6033. And I'll say that again later in the workshop, but it's 1-800-936-6033. So any of this information that comes up during the course of this presentation and where there are web links for you to check out, if that's not an option for you, do check with the Dementia Helpline to get some information for you. So home and community care provides a range of health care and support services. And again, there is information on their website. The other way you can get some of this information besides our Dementia Helpline too is you can call HealthLink BC. You can check their website, which is healthlinkbc.ca, or you can call them at 811. So it's a fairly easy number to call. And so they can give you information, they can give you numbers for specific departments through HealthLink BC. So that's a very useful resource as well. Now there is a a policy manual for home and community care if you want to get some more details about this. We're just doing the quick Coles Notes version here today. The policy manual provides detailed information about the policies that they work with, describes eligibility for services, explains the process for determining client rates, because some of the services, there are fees associated with them. And you can get them at the website that's on the screen. And again, any of these slides you can download. It's in the little box called Navigating the System that I had up on the screen at the beginning. Or call the Dementia Helpline or call HealthLink BC to find out more details. I will be talking briefly about eligibility and whatnot, but if you want more details, by all means, give them a call. Now, overview and definitions, we'll go through different programs available through home and community care, including home care, home support, and they are two different things. A program called Choice in Supports for Independent Living, also referred to as CECIL. We'll look at adult day programs and at respite care. So our focus today really is on navigating the system prior to the person accessing long-term care, so prior to going into a care home. We do have a workshop available through our resource centers, plus we do it on the teleworkshops called Transition to Residential Care. And so that one would look at basically the system that would attach at the end of what we're going to talk about today. We're focusing on community today. Now this next slide, for those of you who don't have the computer in front of you, this next slide is really just a quick snapshot of some of the available services and what they do. So I'm going to run through it very quickly. On the far left, you have the family doctor. The family doctor can do assessment and diagnosis as well as provide prescribed medication. Not all family doctors prefer to do the assessment and diagnosis when it comes to dementia. They may refer to a specialist. So there are the specialists. That's the next column. Family doctor referral is needed to see a specialist. They will do assessment, diagnosis, and prescribing medications as well. Now, the Alzheimer's Society, we have our local resource centers. I'll talk about this more right at the end of the workshop. Our Dementia Helpline, as I mentioned. We have support groups for caregivers. We have support groups for people who are in the early stages of Alzheimer's or another dementia. And we do lots of education. So that's kind of at least a snapshot of some of the things that we do. Then there's legal and financial services. We recently had a teleworkshop called Planning for the Future. And we looked at representation agreements responsible for health and personal care decisions. So your representative will step in for you to make health and personal care decisions when you can no longer make them yourself. We looked at things like power of attorney, and in BC, power of attorney is a financial and legal tool only. So the person who has the power of attorney for you can't make healthcare decisions or personal care decisions unless they are in a role that puts them in a category called temporary substitute decision maker, and that would include things like spouse. Also, there's the disability tax credit when we're talking about the legal financial services. I'm hoping to have a tax specialist do a teleworkshop for us in the late winter, early spring before tax time, so they can go into more detail about that. We do have a teleworkshop on our website that looks at the tax situation when it comes to dementia. And there's also information on the Canada Revenue Service website on the disability tax credit. Veterans Affairs, they are responsible for things like pensions, treatment, benefits. They provide home support services to veterans, adult day programs, respite care, and also care homes that are under the auspices of Veterans Affairs. So if your family member with dementia is a veteran, don't hesitate to contact Veterans Affairs to see what you might be eligible for. There's private care agencies, and private care agencies, which are non-subsidized, you pay for them up front. They provide home support, and there also are care homes that are operated privately. And then there's home and community care, operated through the health authorities. They do assessment for care, home support, home care, adult day programs, respite care, and care homes that are all under the auspices of home and community care. So that's just kind of a snapshot of where services might be available to you. So we'll start with home care. Now, the whole purpose of home care is to help people remain at home for as long as possible. And really what we're talking about today in terms of the community services, that's bottom line. We want people to be able to be in their own homes for as long as possible, as safely as possible, and so that family members also are able to cope. So it's not just a matter of the person with dementia having their needs accommodated. The goal, too, is to accommodate the needs of the carer. So if you happen to be the spouse or the adult child, to take your needs into account as well. So to help people remain at home for as long as possible, with home care, the focus is on medical care. So, for example, nursing services, community rehab services. An occupational therapist can provide safety assessments of the home as well. And this is a good thing to check out, because when you're looking at, for example, falls prevention, when it's your own home, you often tend to develop blind spots. There's various quirks in our own homes that have been there for ages, and we've adapted to them, and we trip on the end of that silly rug, and I should tack that rug down one of these days, and I don't. And after a while, you just normalize and you don't even see it. If you have an occupational therapist come in and actually do a safety assessment of your home, they will see these things. They will take note of the shaky railing for the stairs, the rug that slips all over the place, the electrical cords that are an electrical hazard waiting to happen. All of those things they'll be able to check out for you and give you tips on how to make your home safer. Now that's home care, focusing on the medical end of it. There's also home support. Again, the goal is to help people remain at home for as long as possible. Service here is not provided by a nurse or an occupational therapist, physiotherapist. Service is provided by a care aide with home support. And the goal is to give personal assistance with daily activities. And so it's not medical care, it's the daily activities care. Services performed may vary between regions, so certainly they might vary between regions, and if you're accessing private versus home and community care services, they may vary as well. One of the difference in terms of private versus the subsidized is sometimes private home support services, they can be a little more flexible in terms of the workers that you get, in terms of qualities that you're looking for in the workers. So for example, your father needs some help getting dressed every day, and so you contact home and community care in your region, and you say that my dad needs someone to come for 2 hours every day to help him get dressed and get his breakfast. Problem is, Dad doesn't speak English anymore. He's lost the ability to speak English. He only speaks Ukrainian. Well, home and community care says we just don't have anybody that speaks Ukrainian, so we can send someone, but the language will be a bit of an issue. And there may be issues in terms of the amount of time as well that they can allocate to your dad. You call a private agency. If they don't have someone that speaks Ukrainian, it's very possible that they will try to hire one, so they can be more flexible that way. They can be more flexible in terms of ensuring that your dad has continuity of care, so has the same worker 5 days a week and then just relief on the weekends or something like that. They are able to accommodate that. That's not always the case with home and community care. So there certainly are differences in their ability to accommodate needs, but nevertheless, you go through a caseworker. We'll talk about this in a moment. See what you're eligible for, see what type of subsidized services that you are able to get, and then sometimes some people will beef up with private services. I also mentioned that program referred to as CECIL, Choice in Supports for Independent Living. Now this is a program that was originally set up for people not with dementia, but people who had significant, mostly physical, but not necessarily, health challenges where they needed staff to help them on a very regular basis. And so it was set up so that the client could manage his or her own services. So there's a pot of money that is allocated to you as the client. So for example, if you happen to be a quadriplegic and you need help with your personal grooming, dressing, meals, that kind of thing, then there's a pot of money that's allocated to you, and you hire your own staff. So you take this money and you use it as you see fit in terms of getting staffing. So that's what it was originally set up for. It is also available for people who are caring for those with dementia, although it's not appropriate for everyone. There was a requirement that it could not be family members that would be paid to provide this service, but there are exceptions in terms of situations where the complexity of care is such that it would be difficult for somebody else to provide it, that they can make exceptions. So it certainly is worth looking into. Eligibility depends on the need for daily personal assistance, the person's ability to direct all aspects of their care. Now this piece is a little more flexible when it comes to people with dementia because they will not, as the disease progresses, be able to direct all aspects of their care. But there has to be somebody else. So there has to be a representative, whether that's, spouse, child, whoever it is, somebody else who will be able to direct all aspects of the care in the stead of the person with dementia. And they have to have the ability to manage the care service. So again, this would be the carer, the family member, whoever that would do this. They have to be able to manage basically a little business is what it boils down to. And so it's, hiring staff, paying them the whole 9 yards. Some people find this too onerous, and this is not something that they would be able to do. Others, it fits the bill for them, just fits their personality, fits their skill set, and can be a real bonus for them. Worth checking out. Then there's adult day programs. Now, adult day programs are available throughout the province, in varying degrees. Some places have a significant number of them and no wait list, basically. Other places, the wait lists can be fairly long. So do make your request early if you're interested in a day program for your family member. Programs may include things like recreation, social activities, personal care services. Some day programs have a shower service, a nail clipping, toenail clipping service, that kind of thing. They provide meals, they provide transportation. Now again, they do vary for sure. And the number of days that are available to your family member varies as well. So if the person, depending on the program, if there are spaces and the person is really enjoying going to the program, you may be able to get, for example, 3 days a week. Other places, you're lucky if you can get one. So it really depends on your community, on the program that's available to you. Now with the day programs, typically people are picked up, 9-ish in the morning. They're brought to wherever the program is held. There are activities, there's a lunch provided, and activities in the afternoon. They come home again around 3-ish. Now this not only gives stimulation, it gives a social group to the person with dementia, and they're in a situation where the people that are working with them understand dementia, can work with them, can accommodate their needs. It also gives the caregiver a chance to have a break. They can be a real godsend. Sometimes they're a hard sell for people, and often it's us. Often it's the family member who says things like, "Oh, my dad would never do that. My dad would never like something like that. He was never a joiner." Those kind of comments. And to those people, I would just really encourage you to try, because your dad, if this is who you're dealing with, has changed, and you may be surprised at how quickly he really enjoys being at the program. They will certainly be happy to have you come with him for the first few times and just kind of sit off to the side if that helps him to integrate a little more. For some people, they do that the first time, and then it's like, no, goodbye, I'll see you later. the person's happy to be there. So they certainly are worth checking out. Then there's respite care. Now this involves short-term admission to a respite bed in a facility. The person may be eligible for up to 30 days of respite care per year. So it's maybe because, again, some places there's a significant drain on the services, but generally speaking, it's up to 30 days of respite care per year. And depending on your area, this can be allocated in different ways as well. So some areas can be more flexible. For example, you can have 10 long weekends as being your 30 days. In some places, other places have a minimum number of days that you have to book before they will book the time. So that's something to check out. The respite care, as with the adult day programs, would just encourage you to check it out and give it a try. I remember one woman who was in a caregiver support group I was facilitating, and she had not had a vacation in many years. She was caring for her mom, and she wanted to go on a trip. Her and her husband wanted to go on a trip. So she finally thought, okay, we're going to bite the bullet. Mom is going to go into respite care, and we're going to go on this holiday. But she really was dreading it. So her mom was placed in respite care for 3 weeks. The woman came back from her trip, again, just kind of dreading what the situation was going to be, and her mom almost didn't want to leave. So it can be something that is a far more positive experience for the person with dementia than you anticipate. And, you need a break. Sometimes it's a break that's one of those necessary breaks, as in you've got to go in hospital for surgery. Other times it's those mental health breaks, and those are equally important. Now, the fees for public services. The professional services, nursing, rehab services, that kind of thing, there's no daily charge for case management. And case management kind of are the brokers in this system. No daily charge for nursing or rehab services. So that comes under the medical services plan. Home support services, there's a daily charge, so it's a per diem, depending on your income. So when the case manager talks to you about setting up home support services, they will ask for your previous year's income tax return to get a sense of how much of a payment you can accommodate. Some people are offended by this. It simply helps the system to run, so expect it. Now, adult day programs and respite care both charge a fixed daily rate, but concessions may be made where there is financial hardship. And I can tell you that the daily rate is very reasonable as well. It is a subsidized rate. It's definitely not full cost recovery by any means. But if even the reasonable rate is a challenge for you on fixed income, sometimes it's really tough, then do talk to the case manager about that. Mentioned earlier about the Veterans Program, and so if the person with dementia is a veteran, please do check out Veterans Affairs. They have a federal home care program provided by Veterans Affairs Canada, and this complements the provincial programs for those who are eligible. So for example, you may be eligible through home and community care to get some kind of nursing service. But when you say, gee, my mom could do with somebody to help her in the yard, do yard work and clean up around the house. Home and community care may not be able to accommodate that, probably won't. Veterans Affairs, they may. So, you might be juggling two sources of support, having some services provided by home and community care and some by Veterans Affairs. The toll-free line you can call to check out, and certainly there's always a website. Toll-free line is 1-800-552-2122. I'm going to say that one more time for those of you that are just using the phone here today. So Veterans Affairs, 1-800-552-2122. So even if you are already getting some home care, home support services through home and community care, do check with Veterans Affairs and see if there's any additional services you might be eligible for. Now, the eligibility requirements for home care or rehab services, so this is sort of the medical piece. You need to be a resident of BC. You need to be a Canadian citizen or a permanent resident, so have permanent resident status. And you may require things like care following hospital discharge, so perhaps there's wound dressing that has to be done when you're released from the hospital. You may require care at home rather than hospitalization, so it could be that you do still require ongoing care, but rather than keep you in the hospital, this can be provided in the community. So that, for example, might be something like using a catheter, something like that. They may also provide care due to a terminal illness, and so there are, you have needs based on what's happening with this illness. Now, other subsidized services, so home support, day programs, respite care, again, 19 or older. You have to have lived in BC for at least 3 months, and so what that means is you have to be eligible for BC Medical. You need to be a Canadian citizen or have permanent resident status. Now, you may have a relative living with you who is not under that category. They're not a Canadian citizen, they're not a permanent resident. If that's the case, you will be providing these or paying for these services yourself through private agencies. I would suggest that you do check with your local home and community care anyway, just in case. Sometimes exceptions can be made, and you never know where exceptions might be possible. But just as a general rule, you will likely be paying for the services yourself. Also, you need to be unable to function independently due to chronic health-related problems or an end-stage illness. And so that would be one of the qualifiers to make you eligible for these services. So who can make a referral? Well, basically, almost anyone. So you yourself, so if you are the person with dementia and you're still in a position where you are able to do things like that, you can make the referral. Your representative can make the referral. That might be your husband, wife, daughter, son. It might be your best friend who is acting as your representative. They can make a referral. Healthcare providers, nurse, doctor, social worker, pharmacist, they can all refer you to case management at home and community care. And for more details about eligibility, you can go to the policy manual for home and community care. Application process. Well, first contact by telephone. Phone them up. Say my husband requires help dressing in the morning that I simply am unable to provide for him. I have a bad back and he's a big man, that kind of thing. If the need is apparent, an in-home assessment is done by a case manager. So if your case seems fairly compelling over the phone, then a case manager will come to your home and do an assessment. As I mentioned earlier, the case manager will review last year's income tax return to determine what the daily rate for services will be. Oops. So the role of a case manager really is the coordinator of services. As I mentioned earlier, they're kind of a service broker. They do the assessment and then they kind of, help you access whatever is needed at that time. They make a home visit to assess the person's health care needs and their eligibility. They work with the family caregiver to develop a care plan of appropriate services. So again, this is not just about the person with dementia, this is about the unit. And so this is working with the family to put in the supports that are needed. They review the care plan and make adjustments when they are notified that care needs have changed. And I really want to stress that. They're very, very busy, and that's probably no surprise to anybody. So they may not be checking in with you on a regular basis. I mean, this might be different in smaller communities. Again, there are certainly regional variations, office variations, never mind regional variations. But generally speaking, they will not be checking in with you to see how things are going. It's up to you as the representative of the person, as the caregiver, family caregiver, to check in with them when things have changed. So, for example, the case manager may come to your home, they may do an assessment, and they may say, well, you know, right now, given the resources we have available, given your husband's functioning, there's really nothing we can put into place for your husband at this time. Call me when things have changed. And so 3 months, 4 months, 6 months go by, and your husband is unable to dress himself. You know, he was doing it with some difficulty when you talked to the case manager. Now he simply cannot do it at all. And you're not able to do it because of your bad back or whatever the situation is. Call up the case manager. Say to the case manager, you know, we met 4 months ago. Things have changed. He is having a much harder time now. Before he could get dressed with difficulty if I stood and, you know, cued him the whole time. Now he simply can't do it, no matter what kind of support I give him. So then the case manager is aware that things have changed. So as just mentioned, be sure to update your case manager about all changes in care needs on a regular basis. Now they may ask you things like, can your, I'll stick with the husband as the example, can your husband bathe himself? Now, often, you know, we tend to, as caregivers, even when we're tired, even when we're feeling overextended, we tend to put the best spin on things. So here's the situation. When it's time for your husband to have a bath or a shower, what you do is you have to be the one to tell him it's time. He has no concept that he needs to have a shower. So it's up to you to say, okay, John, it's time for you to have a shower. You go in the bathroom. You help him take his clothes off. You have a towel ready for him. You have the soap and face cloth on the shelf in the shower stall. You guide him into the shower. You turn on the shower and ensure that the temperature is correct for him. You turn it on and shut the shower curtain, and he's able to use the soap and the washcloth to wash himself off. He comes out of the shower. You help him get dried and help him get dressed. And so when the case manager says, can he shower himself, you say yes. Well, no. You know, if that much had to be done before he could actually stand under the shower and get washed, no, he is not able to shower himself. So, you know, be clear about the person's ability and what they can and can't do and how much assistance you're already providing. Make sure you ask your case manager about services that may be helpful now, but also later. You know, get a sense of what's available down the road in your community. Preparing for an assessment, case manager may ask to see your BC Care card. They probably will. Any prescription medications that the person is on. If they are a veteran, any war veteran or pension check stubs. Most recent income tax return, you know, to see how much subsidized help is available, your doctor's contact information, and the contact information of a close relative or friend. So they'll need some of this information. So it helps to have a list of questions in advance. You know, when someone comes to your house, it's so easy for all those questions that you had milling around in your head to go flying out the window. So have a list of questions before the case manager comes. Write down the tasks that the person needs assistance with, and again, really needs assistance with. So bathing, dressing, going to the bathroom, eating their meals, preparing their meals. Make it very clear how much they can and cannot do on their own. Now, the interviewer, the case manager, uses a standard assessment tool when they meet with you, and some examples of what they're looking at. They want to get a sense of the person with dementia's cognitive functioning, their communication abilities, what their vision is like, what their hearing is like, any mood and behavior patterns, you know, what's going on there. Social functioning, how are they managing in a social situation? Are they? Their physical functioning, you know, are there any physical issues that make life a challenge for them? And they want to get a sense of the safety of the home environment, physical safety, but also emotional safety. If you as the caregiver are completely burnt out and at the end of your tether, there's an argument to be made that perhaps the person isn't terribly safe there, nor are you. Now, making the decision, and it can be tough, you know, when you're sitting back thinking, you know what, I can't do it all myself. Most of us have a hard time admitting that and reaching out, and particularly reaching out to, you know, the government. That can seem scary. So when is it time to access the services? Well, sooner rather than later. At the very least, even if you were not eligible for any services right now, you will get a sense of what's available in your community. And it's also important to access services as the care needs increase. So recognizing that right now you have 1 hour of home support service available to your family member per week, and that's to help with a weekly shower. As time goes on, the care needs will increase. So who decides which services to use? Well, certainly the person with dementia. Their willingness to participate in this is crucial. Having said that, as the disease progresses, that can be a challenge, and it can be a challenge for the caregiver to be creative in encouraging the person with dementia to accept services. It also is up to the legally appointed decision maker. So that will be the representative. I would really encourage you to ensure there is a representation agreement in place. If you are the named representative, then you do have the legal authority to make these decisions. What makes the decision to access services so challenging? Well, you know, often it's a real dilemma because you feel like you're making a choice between two equally undesirable alternatives. On the one hand, you have you as the caregiver overwhelmed, overextended, tired, maybe sick, you know, and on and on and on. It's become too much for you. On the other hand, you have a so-called stranger coming into your home that the person with dementia is really not keen on having in your home, and that's a bit of a battle. And so it can be that, you know, which is the worst alternative, and it can be a hard choice to make. As well, you know, emotions get stirred up. There's often that tug of war between emotions and logic, you know, the emotions that say, this is my husband, it's my responsibility to care for him, I don't want a stranger looking after my husband, I should be the one, you know, that emotional connection, and the logic. I can't do it anymore. I'm too tired. I have nothing left of me right now. And so it's often that tug of war between those two. And then there's the reality of finite physical and emotional energy, you know. And so you're making a really hard decision when it's probably the hardest for you to make decisions because you're really tired. So it makes this whole decision to reach out very challenging for people. There's also that transition of authority. You know, when you access services, it's like you're passing over a piece of your authority as the caregiver to an outside agency. And certainly the person with dementia is passing over more control over their own personal self to someone else. The roles change. You become, to a certain extent, a support person to the worker as well as a support person to the person with dementia. And so there's a role change for you. And it can affect the family dynamics as a result. Now, the emotions that might get stirred up, sadness. You know, the fact that you have to reach out is proof that the disease is progressing, and it's hard to acknowledge that. There's often discomfort with the questions that the case manager is asking. You know, they may seem very intrusive. You might feel judged. The person with dementia might feel judged, and it could be uncomfortable. Speaking of discomfort, just having, you know, again, the so-called strangers in the home. There's somebody coming into your home, helping your family member with intimate personal chores, being in your space, it can feel very intrusive for a lot of people. And there also may be a great deal of frustration that the services available might not be the best fit. Ideally, you would reach out for services and they would be able to be tailored absolutely specifically to your needs, the needs of your family member, in a way that meets all of your needs, ideally. In reality, that is often not the case. And again, depending on the community, on the office, sometimes it's really not the case. And so it might be very frustrating. So in terms of having conversations to make these decisions, if possible, involve the person with dementia. I mean, this is, after all, about them. So as much as possible, involve them. As much as possible, involve them before care is ever needed, so that, you know, you've had the opportunity to talk this over when they were able to. Recognize that dementia intrudes on the person's ability to make an informed decision. And so you may need to make a decision that the person is not happy with at that point. Reassure the person that you want the best for him or her and you want to keep them safe. And you want to keep them at home, and that's the other piece of it. You know, I know you don't like it that there's this person coming in twice a week, Dad, but, you know, you need the help. I need the help. I'm getting so tired, and I want you to be safe, and I want you to be able to stay with me as long as possible. Now, that's being logical, so this is one of those discussions that's best had as early as possible, so do have them. Ask the person with dementia to accept the service for your sake. They may say, I don't need it. I don't need anybody coming in here helping me get dressed. You know, ask them to do it for you. You know, John, you probably don't need the help. But I'm just getting so tired, and this is not your fault. This is me. I need the help. Putting it in those terms, when a person cares for you, they may welcome the opportunity to do something for you because everything's been about them to this point. Acknowledge their underlying fears. I know it's scary. I know it's so scary thinking that there's going to be strangers here. You know, I will do everything I can to make sure it works out as well as possible. Good caregiving sometimes means doing what a person needs, not necessarily what they want. And that's a hard reality as time goes on. So encouraging service use, start gradually, you know. Have the person come in for a very short period of time. Think creatively about what might work. So it might be there's a home care worker or a home support worker coming in. You may need to say something like, this is my friend Janine. She needs a little bit of extra work. She's a single parent, so I asked her to come and give us a hand a couple of times a week. I hope that's okay. It might be something like that, and that's one of those little fiddlets that sometimes is necessary to help the person accept some of these changes. Persevere. If it doesn't work today, having that discussion might work tomorrow. Experiment with different ways to sell it. So, for example, this is for me. I know you don't want help. The doctor said this is important. This is a free service, even if you're paying. You know, a lot of people will not want to pass up a free service. This is my friend who needs, you know, the extra work. It's only temporary. You know, things like that can help the person accept the service. Example of a little script. Sweetheart, I love you and want to do the best for you. I will take care of you as long as I possibly can. I want you to be safe and well cared for, and that might mean letting someone else help us. I just want what's best for you and for us. Another example, Dad, you know I care about you and want to help you stay in your house, but I need to have some time away for my own health. For my sake, I'd like you to think about staying somewhere else for just a couple of weeks. I just want you to be safe. Might help. Another example, I need someone to help clean because my back is so sore these days, and my friend Mary needs the work to help out her family. I'd really appreciate you going along with this for my sake. Again, when people are increasingly needing help from others, sometimes it's a bit of a gift to have them feel that they are giving a gift to you. Another example, everybody at the center is counting on you to go today. This is the day program. They need your help to get the work done. Or Mrs. Jones needs you to be there to push her wheelchair. You know, she counts on you being there. Be prepared to manage resistance on an ongoing basis. Some people are incredibly lucky, and the person with dementia accepts the service, is happy with the service, and this is the trend. Don't bet the farm on that. So be prepared that there may be resistance.